Welcome to the video on verifying MHCP eligibility in minutes. In this video, we will demonstrate how a provider uses minutes to verify eligibility for Minnesota Healthcare Programs, or MHCP, for a person receiving care at their location. In minutes, the person receiving care is referred to as a subscriber. MHCP requires providers to verify a subscriber's eligibility before providers render services and submit claims to MHCP. We will log into our Minutes account to begin. We will select Eligibility Request 270 in the left navigation after we have logged in. This opens the Eligibility Request 270 page. We will enter the required information on this page to verify a subscriber's eligibility. If we are uncertain what we should enter in each field, we can click on the field name and a pop-up window will display at the top of the screen containing a short description of what information is needed. The first field is the National Provider Identifier, or NPI, or Unique Minnesota Provider Identifier, or UMPI, for our organization. Minutes auto-populates this based on our login information. We are a consolidated provider, so we will need to click on the Lookup button next to Provider Address to select the location where we are providing the service for the subscriber. Selecting the appropriate address for our taxonomy code will ensure that we see the appropriate MHCP eligibility. If we are not a consolidated provider, we would skip the taxonomy code qualifier and taxonomy code fields. For a consolidated provider, the taxonomy code will automatically appear in that field after the appropriate consolidated record is selected. Consolidated providers must choose the taxonomy code qualifier to proceed. The taxonomy code qualifier field conveys additional information about a provider's role in the eligibility transaction. After we have selected the taxonomy code qualifier, we can proceed to enter the subscriber's information. First, we enter the date of service. This field auto-populates with the current date. To enter a different date, we delete the current date and manually input the correct date. We can verify eligibility for the previous 12 months, but not for a future date. If we need to verify eligibility for a date that is more than a year old, we would call the MHCP Provider Resource Center at 651-431-2700 or 800-366-5411. Next, we enter the personal information to look up the subscriber. We enter the subscriber ID and birth date. We could also look them up by entering their birth date, social security number, last or first name in the appropriate fields. The link titled Eligibility Help, located at the top right corner of this page, displays a table of allowed combinations of personal identifiers that are needed to find the subscriber. We can submit the request now, or select the Enter Optional Information field. In this section, we can enter more information about the subscriber, the provider, and trace information. If we needed to look up eligibility for multiple subscribers, we would click the Add button at the bottom of the page and repeat the previous steps. Each time we select the Add button, the subscriber's information is added to a list displayed at the bottom of this page. We can add a maximum of 50 subscribers. We are looking up the eligibility for one subscriber, so we click the Submit button at the bottom of this page. This opens the Eligibility Response 271 page. If the subscriber does not have MHCP coverage, we will see a message that states that the subscriber is inactive. In our example, the subscriber does have MHCP coverage, so the screen will display a series of tables and a determination for eligibility. Let's look at the information that appears on the screen. The first two tables contain the subscriber information, the date of service, subscriber ID number, subscriber name, birth date, age, gender, and address. The next section contains the provider information and address, followed by trace information. The eligibility information for the subscriber starts at the header titled Major Programs. In our example, the subscriber is eligible for MA or medical assistance. Their eligibility began July 1st, 2018, and there is no end date. The rest of the information in this section lists other services the subscriber is eligible for. If we required more explanation about the information contained on this screen, we can click on each header to display a pop-up window containing a short description. If we had submitted multiple eligibility searches, we would click the Next button on the bottom right of the screen to advance to the next response. If we need to submit a new eligibility request for a new subscriber, we select the New Query button on the bottom left of the page. If we need to change the subscriber, we click Edit Query, also at the bottom of the page. We select the Main Menu button to return to the Minutes home page. Now that you have learned the process for verifying eligibility for subscribers, you can easily determine a person's eligibility for MHCP services when they receive care at your location. The Department of Human Services offers various training opportunities, including other on-demand videos and online sessions. You can register for the online sessions by visiting the MHCP Enrolled Provider Training page on the DHS Provider website. Check the MHCP Provider News and Updates for announcements on changes to programs and information about new learning tutorials when they become available. Thank you.